Hello, if you're watching this video, you've either purchased or was given a posture pump to try at home. So we want to give you a quick little demonstration so we make sure that you use it correctly when you get back to your own place. So when we're setting this up for home usage, we want to make sure that the posture pump is sat on a nice flat surface and something that you can comfortably lay back on. So when we do this, the most important piece is going to be where this portion, where the air comes in, hits on your neck. So I'm going to have Nicole demonstrate, and so as she lays back, I'm going to kind of center this so that that part of the air pocket hits this very center part of your neck. And the biggest part of this too is you want it to be comfortable, right? We don't want it to be that feels like it's in an incorrect place. And before we do the next part where we strap somebody in, what I'll have our patients do is just do a little test, is just put a little air in it and see if it feels like it's in the center, it's not off to one side too much, it doesn't feel like it's too high or too low. And you'll know that feeling once you do it a couple times, that it feels like it's centered. So the next part we're gonna do is we're just gonna have the strap come in and help hold our head in. And again, this isn't supposed to be tight, but it is supposed to be a little firm. We're gonna put it just at the center part of our forehead, tighten one strap down, and then tighten the next one, just so it kind of holds that head into place. So then, as far as the number and the time, what I have our patients start with is it's gonna be how many pumps and how quickly we do it. So at the beginning, I tell patients I want it to be up to 7 full pumps with the bladder, always stopping before it ever hurts. So if you start to get uncomfortable, if your neck doesn't quite feel right doing it, stop at whatever number that is. And so what we're gonna have Nicole do is we're gonna have her just do a couple pumps just to kind of show you just the speed at which to do it at a comfortable level. And once you get to that point where you feel like that's as much as you can handle comfortably, I say hold it for a count. Once that count is over, then you're gonna press the little white button that's attached to the bladder and it's gonna let the air out. So once the air releases all the way, you're gonna hold that for another count and then you're gonna repeat that process. We're gonna do that a total of 10 times. On the 10th time, I want you to try to pump as much air as you can comfortably and hold that for no longer than a minute. Once we've gotten through a couple days of doing this and you're not experiencing a lot of neck pain or soreness, you're not experiencing any major dizziness, then we can work at increasing the number and the times that we do it. The other thing I really make sure patients understand is that this might increase a little bit of blood flow into your brain. So when you get done and we unstrap ourselves, what I tell people is when you sit back up, to give yourself a second to kind of get your bearings a little bit, not to just jump up and start going, because you might feel a little bit dizzy or wobbly at that first couple seconds, but that should pass pretty quickly. If you have any questions on this, you can always call us or email us and we'll try to straighten you out.